Excuse me, is it 9 o'clock?
Yes, it is.
Do you know what happens on VLB every Saturday morning at 9?
Yes, I do. It's time for 15 diabetic-friendly minutes, all brought to you with the compliments of the Barbados Diabetes Foundation.
I didn't know that. But I don't know what's happening in today's show.
In today's show, Dr. Diane Braffett has this to say about people's health targets.
People have individual targets, and remember, what suits Jack doesn't necessarily suit Mary.
So is your name Mary or is your name Jack? Maybe it's Peter, Marsha, or Armenta. Whatever your name is, Dr. Braffett will be speaking this morning on the whole patient approach to health, physical, emotional, and lifestyle factors, and the importance of regular screenings. When was the last time you got a health check? You see that? You him in a hurry. That's why you need to listen to the next 15 minutes coming up, all with the compliments of the Maria Holder Diabetes Center, the Barbados Diabetic Eye Screening Program, and the bank that you don't have to hem and haw no more because they can make all your financial dreams come true. Republic Bank.
Dream a dream and watch it become a reality. You can do anything. Pull up a chair, come sit and come share with Republic Bank. You can do anything. Yes, we're the one for you, making dreams come true. We're the one for you, your partner for life. We're the one for you, Republic Bank.
If you are diabetic or pre-diabetic and you need diabetic services, but you need to make your dollar stretch no further than the Maria Holder Diabetes Center. For vascular, podiatry and diabetic eye screening services or consultations with diabetes doctors and nurses, call 417-0305 today. The Maria Holder Diabetes Center, located in Warren, St. Michael. They can save your life and save you money, but members get 10% off.
10% discount off! You cannot argue with that, and it's just one of the many benefits that you can receive when you visit the Maria Holder Diabetes Center, located in Warren, St. Michael. I was there up to last week. When was the last time you were there? Well, you need to visit. Good morning to Dave and all the VOB people. This is Peter Boyce here, and I have some statistics for you this morning. Do you know that 1 in 3 people with diabetes also have high blood pressure? I bet you didn't know that. And then there are some people who don't have diabetes but got high blood pressure, and they don't know it either. And then I got people who are diabetic and have high blood pressure, and they don't know they have either of the two. That is why if you are diabetic or pre-diabetic, or you might feel you are none of those two things but you might want to check, you need to head to the Maria Holder Diabetes Center. That's where you can also find services like eye screening for diabetic retinopathy. You're supposed to do that every year once you're diabetic. Vascular screening for if you feel you might have bad circulation. Podiatry for treatment by Louise Robinson. She's very good at what she does. Take your feet to her. And nutritional advice from dietitian Victoria Cox. You've been trying to lose that weight ever since. Victoria Cox can help you to lose it. Call and make an appointment with her. You can also get a consultation with diabetes specialists like Dr. Diane Braffett. And speaking of Dr. Braffett, she is our featured speaker for the morning, and she will now be speechifying you on the whole patient approach to medical care. So without any further ado, here's Dr. Braffett.
Hello, good day. Happy Saturday, Peter.
Happy Saturday to you too, Dr. Braffett.
Of course, happy Saturday, Alfonso.
Happy Saturday, Dr. D. You didn't call my name first, but I guess you were saving the best for the last.
And to everybody out there who's listening in to us, we hope that you had an enjoyable and a safe crop over. Alfonso, are you still standing? Last man standing?
Still standing and working up.
But hope you enjoyed everything, and I hope the both of you managed Golden Soca well. I heard it was such a great show. I unfortunately wasn't able to attend this year, but I'm just glad that it came off so well. So congratulations to the team of Peter and Alfonso.
Thanks, Dr. D. Try and make sure I come next year here.
So today I've been asked to talk about, interestingly, holistic approaches to diabetes management. And I think it's a great topic, really. And so what that really means is, you just don't treat a patient who's living with diabetes as if you're you're just treating a blood sugar. You have to really look at the whole person, which means that care has to be individualized and it has to be tailored towards that person. That's why we always say that the patient is the center of the care, and the patient ultimately should be the decision maker as to what they're going to do, but they make those decisions with your support, with informed care, basically. Okay, so what we want to think about with the person is, first of all, looking at the person. Do they require very tight diabetes control? Does their control need to be a little bit looser? Maybe they're elderly and they live at home. So we decide on individual targets for the person. That would be an individual target, maybe for the A1C, and maybe even for the blood sugars as they check them day to day, whether it be a fasting blood sugar, whether it be a blood sugar that's done 2 hours after a meal, etc. So people have individual targets, and remember, what suits Jack doesn't necessarily suit Mary. So if you're living with diabetes, don't necessarily try to enforce what you're doing on somebody else, because your two bodies are very different and your targets might be slightly different as well. I mean, there are general principles, of course, like we know nutrition, leave out all the sugary beverages, the sweet foods and that kind of stuff, mind your portions, but there are other little modifications that people might need to make between themselves. We also want to think about, remember, diabetes management is not just about diet, although I always say diet is everything, because you are what you eat. It's very hard to get good diabetes control if you're not eating healthy or in a balanced way. But you also want to think about things like physical activity. What kind of physical activity is going to suit the person? Are you able to get up and walk? Can you walk quickly? Can you maybe break into a jog sometimes? Or are you somebody who really can't handle the walking? Maybe it might be a bad back or some bad knees. Some people may not enjoy walking. There's some people who prefer to garden rather than walk, or they prefer to dance. For some people, swimming might be better because it takes the weight off of the joints. Okay, so it's finding a physical activity that works for the person. Suppose that person is in a wheelchair or they've had a stroke. Is it possible to do upper body exercises? So we have to think about these things when we think about the person, what suits the person. But remember, I'm calling out some key things. We've talked a little bit about nutrition, physical activity. Then you want to think about emotional factors as well. Okay, is this person in a good state of mind? Are they suffering from distress for any reason, or maybe depression, or maybe anxiety? So these are things that all have to be addressed, because when you have a person who's overly stressed out, they're not going to be paying attention necessarily to diabetes. They may forget to take their medication because they're not focusing or they're not concentrating. And so therefore, there has to be this holistic approach towards managing diabetes. I like to think of it towards managing life. If you know that you're, say for example, somebody who's a worrier or stresses easily, are you putting into place some techniques so that you can be more relaxed? Maybe some meditation. Are you taking a few minutes out for yourself every day to center and ground yourself and to put yourself in a positive frame of mind? Okay, so remember, you are a whole person and you're living with diabetes, but you are not diabetes. Don't forget, if you're living with diabetes, high blood pressure is extremely common in persons who have diabetes or pre-diabetes. Make sure you know your numbers. Make sure your blood pressure is controlled. Blood pressure management is obviously a part of the care that we deliver at the Diabetes Center because it is so common in our population. Is your cholesterol profile controlled? Okay, and what if you have diabetes but then you have maybe an issue with the heart? Is your issue with your heart stable? Remember, everything works together. So at the center, we focus on your whole body, the whole you, the physical and the mental you, and then work on seeing how we can cater towards you, the individual. But that's also your job as well at home, is to figure out, how do I tend to all of these different needs that I as a human being have? How do I draw boundaries for myself? How do I take care of myself? How do I block out time from work so that I can take care of myself? We find that a lot of persons who are middle-aged, they sacrifice almost everything that they have and they are for work, and they neglect their health in preference for work. But that's not a right approach, because obviously it means by the time you retire, you may have so many medical problems because you've not really tended to things properly. You then can't enjoy your retirement. So remember, you are a whole person, and the whole of you matters. And of course, sleep and rest. This is something I've had to teach myself. R&R is a critical part of life, and you have to figure out how to create space for that and how to put tools into place to make sure that you're getting enough rest with your busy lifestyles. So thank you so much for listening to me today, and I just want to highlight once again the importance of regular diabetes screening, blood pressure screening, and cholesterol checks. When last have you had a diabetes screening? If you are over the age of 35 or under the age of 35 and you're living with a family history of diabetes or other risk factors for diabetes such as polycystic kidney disease, or maybe mommy had diabetes during pregnancy, that's called gestational diabetes, or maybe you're under 35 but you have high blood pressure and high cholesterol, or maybe you put on weight suddenly. Remember, early diagnosis is what is going to give you the best chance of remission, very tight control, and having a good, what we call legacy for diabetes care if you're not able to get rid of it. People who diagnose and control their diabetes very early and control it well are much less likely to have complications than if it goes undiagnosed or is poorly controlled. Have a beautiful weekend. Take care of yourself. And my word to you this weekend is remember that you are special. Sometimes you have to learn how to put yourself first. Bye.
Bye, Dr. Day. Yeah, I'm good. Happy weekend to you too. As we go into our weekend song of the day, this is Edwin Yearon who performed at Guara Soccer last week. You should have been there. This is Edwin with the weekend song. Compliments the Maria Holder Diabetes Center and Republic Bank.
Working all day, Monday to Friday, hard work, no pay. Gotta do it anyway. Bills up sky high, makes you wonder what you wanna make you cry. You're barely getting by, but then the weekend rolls around. Now it's your time to hit the town. Ooh, you're feeling great, you're feeling fine. Yeah, you know that it's your time to shine.
So remember, you are a whole person and you're living with diabetes, but you are not diabetes.
The weekend come, oh, weekend come, it's time for fun. I'm heading to town. Give me room, let me go. Give me room, 'cause it's my time.
The Maria Holder Diabetes Center.
The weekend, let's ride. Give me room, 'cause it's my time. Lose control. Work done. Looking for a party, need somebody, get laid maybe, feeling lucky. Looking for a good friend, just for the weekend. When it's all over, up to a good end. But then the weekend rolls around. Woo! Now it's your time to hit the town. Ooh, you're feeling great, you're feeling
The
fine.
Maria Holder Diabetes Center.
You know that it's your time to shine. The weekend come.
In 2025, the Maria Holder Diabetes Center, located in Warren St. Michael, with their diabetic eye screening, vascular screening, and podiatry services, offers a standard of diabetic services that equals or surpasses any you might receive internationally at a price that everyone can afford. So if you are diabetic or pre-diabetic and listening to VOB right now, call and make an appointment to get your eye screened for diabetic retinopathy by calling 243-3937. Or if you are having vascular or circulation issues or need to see a podiatrist or nutritionist, call 417-0305. The last 15 minutes you heard on VOB was brought to you with the compliments of the Barbados Diabetic Eye Screening Program, Republic Bank, and the Maria Holder Diabetes Center. Until next time,
Remember, diabetes isn't just about sugar. It affects your heart, kidneys, eyes, and mind.
Did you know nearly 1 in 5 adults in Barbados have diabetes? Did you know diabetes is one of the leading causes of vision loss in the world? Regular eye screening can save your eyes. Contact the Barbados Diabetic Eye Screening Program today at 243-3937 to find out how you get your simple digital eye screening done for just $100. Or members get 10% off.
Dream a dream and watch it become a reality.